Welcome, everybody. It's Monday. Welcome, welcome. So, where's everybody coming in from? I know I am in the great state of Texas right now, Dallas to be exact. It's a little warm. I am originally from Chicago, so I'm always going to be a Chi-Town girl. So, I have to, rep Chicago. But where is everybody coming in from? All right, we got DC. Okay, New Mexico, South Florida. Ooh, what is that weather like in South Florida? I feel like it's just as hot there as it is in the great state of Texas. Okay, Michigan, Midwest. Yes, Josh. Ooh, New Hampshire. Welcome. Okay. Now I'm kind of jealous. SoCal. Now y'all showing out there. Ooh, Kingston. Nice, nice. Well, I am so glad that you guys decided to join us on this good Monday. My name is Danielle, and I'm our Senior Director for People Operations. But continue to put where you're from in the chat. I can't wait to see. I love to see where we are reaching and how far we get to connect with people from across the country. I'm so excited about this panel. I was like, I know we had one a couple weeks ago. I was like, we got this one. We have another one coming up. You all are in for a treat. I'm excited. We got a lot to talk about. A lot to talk about. Where is everybody from? I see we got a few more people that come in. Put in the chat where you're from. Oh, OC family. There we go. There we go. Harrison, do you want to show us all up and say where you're coming from? Okay. We got Detroit. Yes, Detroit in the house. Midwest. I love it. I love it. Right. Harrison wants to, show us all up. He may or may not be coming in from Ireland, Dublin to be exact. I was like, I thoroughly enjoyed being there when I was there last time. San Francisco. Okay. Nice. Yep, Detroit. Yeah, exactly. Rachel knows. Go Bears. I am from the Midwest. Go Bears. It is. I apologize to all the other fans. I'm sorry. I have the mic so I can say go Bears. We're going to give it a few more minutes for a few more people to come in and log on. We don't want anyone to miss out. And then we're going to go ahead and get this started. Okay, now you know what? Don Payne, now you're doing the most, okay? It's always going to be the Chicago Bears. I don't care where they live. Thank you very much. Thank you. John's trying to start some stuff at this point. Trying to start some stuff. All right. We're gonna give it a few more minutes and then we'll go on to the our question. It wouldn't be a panel without having a question for everybody. Oh, St. Petersburg, Florida. That's where my grandfather was from. I love it. We got a lot of Florida in the house. Okay. And we got some Cali in the house. Warm states. Okay, now Josh is doing too much now. Josh, now not too much on the Chicago Bears. See, they want to get on me today. They're trying to tease me on this good Monday. That's fine. All right, so would we like to go to the next question? Oh, we got Arizona. We also have San Diego. Again, California says we're going to show up. Okay, so to kind of get this ball rolling, right, and have this conversation, I want you to put in the chat what concerns you the most when it comes to America's approach to public health and public safety? What concerns you the most when it comes to America's approach to public health and public safety? I know there's a lot, so we're going to give you a few minutes to write it out in the chat. But tell me what you're thinking. Tell me how you're feeling on this good Monday, y'all. Okay. We got JFK, we got Dr. Oz. I can understand that. absolutely, Ash, that there is not equal access for all. I agree 100,000%. I'm glad that you're here for that because we're definitely going to talk about this. Definitely going to talk about that. Ooh, lack of inclusivity. Absolutely. And disrespect and disregard for real solutions. Yes. I was like the concerns of others, and many people are just being ignored like it doesn't exist. Yep. Youth criminalization. Absolutely. Absolutely. Not following the science. Truly. It's issues. It's definitely issues. Yep. Harrison said it best, turning back the clock on progress. Ooh, John coming in with the heavy, using the prison industrial system and calling it public safety. Come on, y'all. We getting deep real quick on this Good Monday. I love it. I love it. John's talking about and dropping some real good heat right now. It's a lot. It's a lot. I know. And I'm glad that you all are here so we can definitely talk about it because democracy is at stake at this point. It definitely is. Well, with that being said, you can still continue to put responses in the chat, but I am so excited, y'all. I've been looking forward to this all week. I have an honor and a privilege to introduce one of my favorite colleagues. Don't tell anybody about it. Rachel Payton. She is our senior director for Marcom, so marketing communications. This is her baby. This is her dream that she put together. And so without further ado, I would love to introduce Rachel.
Thank you, Danielle. And Danielle is our Senior Director of People Operations. So thank you for being the hostess with the mostest. Gabby, if you don't mind going to the next slide for me. So thank you all again for being here and for being engaged. I'm really excited about the intelligence that we have on our panel today and also the warmth and influence as well that they are going to add to the conversation. So I'll be introducing them a little bit later. If you joined us for the first What's at Stake town hall, a few weeks ago, we really got the conversation started with a deep dive into voting rights and voting rights access across the South. And so that is what inspired this entire series because not only do we need to pay attention to voting rights and voting access, but we need to be paying attention to what's going to be on the ballot this midterm election cycle and even looking forward ahead to the presidential cycle in 2028. So we've got to start having some really important conversations. So again, to set the tone about what's at stake in terms of greater democracy and greater voting rights, right now, 30% of the Congressional Black Caucus and 11% of the Congressional Hispanic Caucus is at risk of losing representation because of the threats, the redistricting threats happening all across the South. So when you look at this demographic, that's about 41% of Black and Brown folks that are at risk of losing representation in Congress. That's a problem, and we need to be talking about that. And we need to talk about what other policies and issues could be affected by that lack of representation. So first, Black and Brown communities are facing the greatest loss of representation, and we have the highest rates of mental health disorders, housing instability, and substance use disorders. Women, specifically women and girls, arrest and incarceration rates for women and girls across the country are increasing, which I believe is not talked about enough, but we have some folks on this panel that are talking about it. While men's incarceration rates remain either stagnant or in some cases are decreasing. And at the same time, women remain the most likely victims of violent crime and public health disparities. So women and girls are getting incarcerated at higher rates, and at the same time, we are most subjected to harm public health and public safety wise. So there's a lot to talk about there. And also, it is June 29th. It is Pride Month, although we celebrate Pride all year long. We also want to talk about what are the overlaps that affect people that identify as LGBTQ plus, particularly those that have been through our incarceration systems. So people that are formerly incarcerated and representative of the LGBTQ plus community, they face compounded barriers between healthcare denial, housing instability, restricted voting rights, and targeted discrimination, just to name a few things off the top. So we are going to do our best to dive into this conversation over this next about 40 minutes. We'll have some time towards the end for some Q&A, and then we'll be sending some follow-up resources following this conversation. So without further ado, I'm going to get ready to start introducing the panelists, starting with Candice Norwood, who is a well-known justice reporter at the 19th. She's been covering incarceration, law enforcement, and our judiciary systems. She's reported on politics and policy since 2016 and probably has been writing about it, and researching it prior to that. But professionally, she's been writing for The Atlantic, Bloomberg News, and PBS NewsHour, to name a few. And her work has also earned a Salute to Excellence Award from the National Association of Black Journalists and the Nell Minow Award for Cultural Criticism from the National Press Club. So thank you, Candice, for being here. I'm really excited for folks to hear from you tonight. We also have Diane Goldstein, who is a longtime partner of Dream.org. Thank you as well for being here. She is the executive director of the Law Enforcement Action Partnership. Lieutenant Diane Goldstein, if I may, is a nationally recognized speaker and writer on criminal justice and drug policy reform. She previously served with the Redondo Beach Police Department, rising to become its first female lieutenant, which I know that did not come without hurdles, some long nights, some long days, some long seasons. So thank you for the work that you've dedicated to public safety. And since 2021, she has served as the executive director of the Law Enforcement Action Partnership, which I believe sometimes they refer to themselves as LEAP. They are a nonprofit advocating for drug policy and criminal justice reform. She holds a master's in criminology, law, and society. Now, the next two panelists are Dream staffers who we have the pleasure of working very closely with, starting with Amanda Hall, who is our Senior Director of National Campaigns here at Dream.org. Amanda is leading efforts here to shape national drug policy and transform the justice system. She's actually the ideator and the executor of our Public Health is Public Safety campaign, which we call affectionately FIPS. So we'll be sending some information about that. And prior to Dream, she directed the largest women's recovery center in Kentucky. She served as a policy strategist at the ACLU of Kentucky. And there she co-founded the Smart Justice Advocates, which was the state's first advocacy group made up of directly impacted Kentuckians. She also holds her master's degree in social work from the University of Louisville. So Kentucky down to the Sox. We're going to hear a lot about what's going on in that community, but also work that Amanda is doing more broadly across the country. And then last, but certainly not least, we have our beloved Justin Allen, who is our New Mexico State campaign coordinator here at Dream.org, where Justin is focused on transforming systems of harm through policy, organizing, and advocacy. His work has been shaped by experiences with the Project ECHO, Health Sciences and America Votes, where he was able to develop skills in community organizing and advocacy, and he's been leveling up ever since. And we're very proud and grateful to have you as a part of the Dream Team, and particularly to be in conversation with you tonight. So thank you all. Virtual round of applause, hearts, and all of that for our panelists. And we can remove the question from the screen, and I'm going to get started with the panel questions. And Candice, as you are getting ready to come off of camera, I'm going to start with you. All right. So, Candice, as I mentioned in the previous slide, women in many ways are the embodiment of public health and public safety. Like I said, we are more likely to be diagnosed with mental health and substance abuse disorders, more likely to experience homelessness. Women arrests are rising, and the arrests of men are declining or staying stagnant. And at the same time, we are juxtaposed with the fact that we are more likely to be exposed to violent crime. And at the same time, Black women in Congress are specifically some of the most targeted individuals who are at risk of losing political representation across the South. So when you layer all of those things, what are some of the downstream consequences of losing these voices of representation for public health and public safety policies that can actually shape improvement and the betterment of our communities?
Yeah, well, first of all, thank you so much for having me. I'm happy to be here to talk about this important topic. And to answer your question, political scientists have kind of looked at this question of what are the tangible effects of people from minority backgrounds, in particular, being represented in the halls of Congress. And the consistent findings are that these are individuals who like regularly influence what kinds of things are being discussed in Congress. So they're elevating which problems members of Congress spend time investigating, what kinds of issues get public hearings, what kinds of bills are introduced, which communities become part of the conversation. And if we're zeroing in on Black members of Congress and Black women in particular, the data also shows that they are significantly more likely to introduce and champion issues that directly affect Black people and communities of color more broadly. And so we can see evidence of this over the last 10 years, in particular, when numbers for Black women representation in Congress have reached their peak. And so just two examples are that Representative Robin Kelly from Illinois has really helped to reframe the issue of gun violence as one not just focused on crime, but also one that is a public health crisis as well. And she has helped to champion community violence intervention programs and federal research into gun violence. And then also another example is Representatives Alma Adams of North Carolina and Lauren Underwood of Illinois helped to co-found the Black Maternal Health Caucus, which helped to champion the Momnibus, which is a package of legislation that helps to identify and find solutions for a variety of factors like nutrition, mental health, housing, et cetera, that intersect to affect maternal health outcomes. And so get back to your question of like looking at the downstream effects of this, when we potentially lose Black women's representation in Congress, we're losing people who are uplifting certain issues that are then, as a result, less likely to be studied, less likely to receive funding and attract resources. And so that affects what kinds of services that communities of color have access to. And I think it's also important to note that this conversation about representation and voting rights is not happening in a vacuum, right? Like we're in this political moment right now where like pushing for diversity more broadly is getting significant pushback across government institutions. And so that is affecting funding. Certain words, right, and certain gender identities are not allowed to be referenced in certain research areas that's eligible for funding. And many community-oriented organizations, as a result, are seeing their funding stripped during this time. So this is all kind of coming together to have big consequences for local communities.
Yeah, you're definitely getting us started on the right track about some of this, the higher level overview and how it overlaps, particularly the representative or congressperson that you mentioned. I think it was Robin Kelly out of Illinois, who is addressing gun violence as a public health issue, which is essentially what our public health is public safety campaign is all about. And we're going to get a little bit more into that, transitioning over to Diane, who, as I mentioned earlier, Diane, you have dedicated your life to public safety, which thank you again. But a lot of, well, let me not speak for you. However, in doing some research on you, I think some of the influence in which you chose to dedicate your life to public safety was because of some of the personal experiences that you've had witnessing how both our justice system and our public health systems can fail people simultaneously at the same time. And so now leading the Law Enforcement Action Partnership, you all have been making the case that treating substance abuse or substance disorder and mental health issues as criminal problems instead of health problems actually makes our communities a lot less safer. So how do you explain to people, especially those in law enforcement, but beyond, on both sides, all sides of the aisle, or maybe they're not even in the room, but how do you explain to people how these systems overlap?
Yeah, this is a really complex discussion. And what I want to suggest to you is that LEAP has been involved in public health and policing for a significant amount of time. And one of the things that I saw both my policing career and my personal life is I had a brother who died from a polydrug overdose that was bipolar and justice impacted, and a person in recovery for long term. And there's this real intersection that I tend to, from a policing standpoint, I don't blame cops for having to enforce the law. What I blame is that our policymakers are actually not investing in the right systems of care, and they're allowing chronic public health or issues of poverty to become so chronic that the only people that answer the phone in the middle of the night are the cops. So Candice brought up something that I think is really interesting, and your campaign is bringing this out very eloquently, is that if we just look at the social determinants of health, and in particular around communities of color and Black women, right? I can tell you that the same social justice determinants of health for inequity in healthcare are the same social determinants of poverty that are the same social determinants of crime. Yet we throw resources into the back end of the problem. So LEAP has existed to basically create an environment that we want to help people and improve community health and safety very, very clearly, and that the criminal justice system is more focused on stigmatizing drug users rather than implementing those systems of care that are more efficacious than criminalization. And it's not just me. You know, law enforcement professionals, both in the United States and across the international globe, because I've done presentations overseas and spoken at the UN, all recognize we cannot arrest our way out of a public health issue and a substance use disorder epidemic. And so what we have to ask is, what is the purpose of our drug control strategy? And I would suggest to everyone here that saving lives and reducing crime and disorder caused by underlying problematic drug use is not mutually exclusive. We can have both. And a response that achieves both ends requires us to move in a paradigm shift that adopts evidence-based practices that link public health first and then policing strategies with our most important outcomes, which is not clearly delineated in our drug control strategy, which is reducing morbidity and mortality associated with drug use and addiction-related behaviors that range from crime to mental illness and homelessness, is first and foremost about saving lives. And if we invest in the right systems of care, we would make our communities more safe, and we would actually make policing safer. Our organization exists to blow up the entirety of the drug war and to sensibly regulate drugs on a continuum, to provide consumer protection, to publicly educate our communities, and to develop systems that actually keep our children safer through age gating and other things that we know work, through the emphasis of harm reduction. And so we tend to view harm reduction as a, good philosophy. And I think that's what's most troubling for me right now, is that we've turned harm reduction into bad words in this current administration. And I think that we all need to recognize that the justice system is not built to solve public health crises. These are complex problems. We are reactive, and we only step in after harm has occurred. And my question is, why do we wait until harm happens to people who suffer from substance use disorder or mental health problems or homeless problems? And then we come in with the solution that the one tool that cops have for the most part is criminalization, and that is the most harmful tool. So for us at LEAP, and for many other police officers that I speak to and police leaders, is this creates a really frustrating cycle that we respond to the same calls, the same people with no resolution, and we end up measuring activity with the wrong stats rather than looking at public health outcomes. Is the policy that we put in place saving lives? And if it's not saving lives, then we need to be doing something else. And so I want to also talk about lived experience real quick, is that if we want better outcomes, we need to listen to people who've actually navigated the system of addiction, homelessness, recovery, and incarceration.
Diane, you are definitely speaking the language of our justice team. And I did not give her that talking point, but it's the perfect segue because I'm gonna take it to our staff who has lived experience next. So, Amanda, you, like I said, you've had lived experience in a variety of ways, and you turned that into leadership and advocacy at dream.org and beyond. You're helping change lives and laws through your work here, particularly focusing exactly on this intersection that we're talking about. So, can you talk more about some of the specific public health gaps inside and outside of the system that make reentry even more difficult for folks?
Yeah, absolutely. And I'm so glad that we're having this panel, Ray. This is great. So I am from Kentucky, obviously, this accent, but I'm from deep Appalachia. It's the second poorest congressional district in the United States of America. It's where the opioid crisis started. So what I love about dream.org is that we have staff that are from rural areas, from big cities, from all across the country. This isn't just a Kentucky thing or a California thing or a New York thing. This is everywhere. Resources are so scarce and so unevenly handed out. Right now it's a really scary moment because we see attacks on things like Medicaid. There is immense research that shows us that people actually having access to healthcare really improves public safety. It improves families, communities. So I remember going into jail the first time, and my mother was formerly incarcerated. This system there's not a moment in my life that I don't remember being part of this system and child protective care systems and all those systems that was told was supposed to help me. And it seemed like they harmed me in my entire life. But when I did go to jail, to prison the first time, I remember thinking, okay, maybe this is where, quote unquote, the bad people are. And I remember getting in there, and it was literally some of the most amazing women that I'd ever met. And what so many of us had in common was the severe trauma. There are rates much higher for women and men that are incarcerated that has suffered things like sexual or physical abuse, come from poverty, and none of these things are addressed. As Diane mentioned, the only remedy solution that we had was to incarcerate us. And just like my family, my mother was incarcerated, I was incarcerated. And thank goodness, I hope that it stops at me. But that's because I finally, after prison, was able to receive mental health treatment for my substance use disorder, able to resolve my trauma. But I'm a white woman from Kentucky. It breaks my heart the amount of women of color, of women in other areas that don't get that. So on the front end, we don't have those resources. And it isn't just the person that's incarcerated, but when my mother was in jail, I was broken, and never did I get any help. Never did a school counselor say, "Are you okay? Like, how are you scared?" Nothing. So I just bottled that trauma up. And like I said, it just cycled. So on the front end, even from our babies, people aren't given the resources that they need. And then while incarcerated, then also folks aren't given those resources. Right now, deaths are rising at an extremely high rate for folks that are incarcerated. West Virginia, deaths rose by 44%. And in 2022, California saw the most deaths in confinement that they had ever seen. Like, I think it's so important that we do not divide this out based on where we live. These federal policies that are coming down, I'm really scared it's going to make it worse on all of us. So that's why it's so important at this time with these people, as from all across the country, that we're having this really, really important conversation, because public health is public safety. And if we want to be safe, if we want to feel safe, we have to invest in the health of our neighbors.
Mhm. I love that you also mentioned, and it's okay, I know your dog wants to wants to be on the panel too. I love that you mentioned your experience even before you were an adult, but as a young child when your mother got incarcerated and nobody helped you. And when we talk about these preventative resources that Deborah mentioned in the chat, it's not just the individual who was incarcerated or who needs the treatment. It's also that family unit that's supporting them, especially if there's children, if they're a mother, if they're a father, because it should be a community approach. How do we stop the community cycle of incarceration or of substance use? And then Amanda, I wanted to ask one more question about, can you speak a little bit more about how these health gaps, like I said, both in and outside of the system, can contribute to making our communities less safe when it's all said and done?
Absolutely. If you think of someone who has came from that severe trauma, someone that suffers with mental health issues that has never been addressed, the way that we treat those, disorders is we incarcerate folks. So folks, before they get in, get no help, while incarcerated, don't get that help, and come out, and often, I mean, there's no behavior change, there's no support, there's no, help with taking care of those needs. And so the cycles just continue. Um, and again, you have another person plucked from their community, plucked from their family, and the gap that leads, again, there's more trauma. It just continues um, to multiply. So addressing those, I think of myself. I actually quit going to jail, quit going to prison, was able to go to college after my mental health and substance use disorder, after those needs were addressed. I was arrested and incarcerated over a dozen times. That's all my life was. And it would have never stopped unless I got those resources. Imagine, like Diane said, if I got them on the front end, then maybe my babies wouldn't have had to, experience that pain of watching me being drug out of my house in handcuffs. That's things that they will never, ever, ever forget. So yeah, that front end all throughout the system, even while incarcerated, though, if it was up to me, you know, folks wouldn't be there. We'd have a whole different way. But while folks are incarcerated, it's really important that we have resources, that mental health, physical needs are met. That's why at Dream we work on things like expanding Medicaid to folks that are incarcerated. So yeah, every point we need to expand those resources.
Thank you, Amanda. I know we work closely together, but I always get inspired listening to you talk. So thank you. Justin, my friend, I'm coming to you next. So you also are part of the Dream Team. You also bring a lot of insightful lived experience to our work and our organization. Particularly after you completed your parole, you were turned away not once, but twice when you tried to re-register to vote. And it took 3 times, plus some additional support in person for you to actually be able to access and re-register to vote after you completed all your responsibilities. You also experienced some targeted discrimination while you were within the system because of being part of the LGBTQ plus community. So you yourself have experienced a lot of these different layers as well. Can you speak to some of those layers of reentry that most people don't see or think about?
Sure. So my name is Justin Allen. I'm calling in from Albuquerque, New Mexico. I want to start by saying that civic engagement is public safety because having a sense of belonging is critical to reducing recidivism. When I got out of prison, after having completed probation and parole, I had a letter signed by a judge explicitly stating that my voting rights had been restored. Yet I was denied twice. The third time, we refused to leave. And so that we stood in the Bernalillo County's office live streaming, and that's how I was finally able to register to vote for the first time. It shouldn't take an act of civil disobedience to exercise our right to vote. In my experience, when someone is told they're ineligible or denied, they often don't try again unless they have support. That's why I started organizing people to register and vote for the first time after the bill to restore voting rights to people on probation and parole had passed. I understand what I call emotional disenfranchisement. It's the experience of feeling so excluded or discouraged that you stop believing your participation matters. Through that work, I also learned that formerly incarcerated people in New Mexico are still being denied the right to vote, even after the law restored their rights for people on probation and parole. So became clear that to me that passing a law isn't enough. Implementation also requires addressing emotional disenfranchisement. Emotional disenfranchisement and disconnection from healthy support networks are barriers to successful reentry that we rarely talk about. Isolation, it contributes to self-defeating behaviors that ultimately impact both public health and public safety. While incarcerated, I experienced targeted discrimination because I was soft-spoken. Officers outed me by implying to other incarcerated people that I was gay. They placed my friends on my enemy list so I'd be transferred into housing units where I had no meaningful connections. Isolation became another form of punishment. I also experienced retaliation for advocating for myself. When speaking up carries consequences, people learn to stay silent. And that fear can prevent people from getting their basic needs met, leading to desperation, recidivism, and sometimes even death. Survival strategy often begins long before someone enters the criminal legal system. It can begin in a home when you're not allowed to be queer. It is reinforced when we're told that anything we say can and will be used against us. Behind the prison walls, silence becomes a way of life. We don't see nothing, say nothing, or hear anything because our survival depends on it. After reentry, advocating for ourselves can be incredibly difficult because speaking with truth and authenticity often carries shame, stigma, and disbelief or fear of retaliation. For people returning home from incarceration, self-advocacy requires a lot of courage, yet reclaiming our voice is essential to reclaiming our dignity. To me, the intersection of public health and public safety is shaped by whether people feel safe enough to speak, ask for help, or stay connected to their communities. When people are silenced, isolated, everyone is less safe. When people feel supported, heard, and connected, healing becomes possible not only for individuals, but for the families and communities that stand beside them. Here in New Mexico, there's an effort to criminalize youth before they're even eligible to vote.
Thank you, Justin. One, I want to give us a little moment, a little breather moment. These are really deep and vulnerable conversations that we're having, and with all of the eloquence and intellect and passion that our staff particularly has, they are living in this and they are working in it constantly every day. So I'm in awe, Amanda and Justin, for your ability to use your experience to help more people, and also for you to speak up in front of groups and to share your testimonies. So thank you for that. I just want to give us a second to reset. And Justin, you had two really great quotes. One, civic engagement is public safety. I really like that. So just wanted to note that. And your coined term, emotional disenfranchisement. That was really great. I'm not sure if I've heard that before myself. But I really like that. I would love to see more work, more conversation around that in this space in general. I also want to note we had, where was it? Patricia Stern, who said, as a former federal felon. I was able to vote. I would help anyone who needed help. Deb Grainer said, me too. So this is a panel conversation, but this is community as well. And so Patricia and Deb and others who may have similar experiences, if you are not a part of our Empathy Network, which is America's largest network of formerly incarcerated advocates, as well as allies, family members, community leaders, that is a group that we would love for you to be a part of. And or if there's anybody else in the chat who's resonating with some of this and who may be looking for additional community, Patricia and Deb, I'm volunteering you to be open for folks to reach out to you in the DMs. So thank you. Continue to chat and to collaborate with one another. Thank you, Harrison. You can text empathy to 97483 to join our empathy network. It is also on our website. But like I said, you can text empathy to 97483 to join our empathy network. Justin, I'm going to come back to you one more time as a follow-up. Can you speak just a little bit more about how the intersection of public health and public safety specifically impacts people that not only identify as LGBTQ plus, or that may just not present their gender the way that people expect them to present it? How does this intersection that we're talking about not only affect those individuals, but the families, the friends, the loved ones, their community that supports them? What are some of the ripple effects as well?
Well, disconnection is why our recidivism rates are so high. And a lot of the disconnection happens or is created through the time during the time we're incarcerated. The longer we're inside, the harder it is to readjust back into community. Oftentimes, for me, I could speak for myself. When I first got out, I didn't want anybody to know where I had been, and so I was afraid to ask questions or like reveal that I didn't know about social media or certain things that was common. And I feel like a lot of folks coming out of incarceration are afraid to ask because of that stigma. We don't want to be judged, and so I feel like we're not welcoming our community members back in properly. I think that when folks come home, it's not just it's hard to readjust if you haven't established healthy relationships ahead of time. And so I wouldn't be here today if it wasn't for the relationships and connections I built here in the community, the healthy relationships and connections I built here in the community. And so when I think about public health and public safety and democracy and recidivism, I think it's critical to start engaging with folks before they get released from incarceration, uh, to start knowing about their rights and different aspects of civic participation that we weren't allowed to engage in the first place. I'll also say that civic engagement is not just voting. Civic engagement is having a sense of belonging and a place in the community. It's having some sort of value. And so when we're intentionally establishing connections with folks coming home, we are creating safer communities.
Absolutely. And I do want to give some space for Craig Browning, who dropped in the chat, as a disabled person living in a vehicle, I feel danger as a result of the criminalization of homelessness. I am a vehicle dweller largely by choice and am concerned about police harassment. And I want to make sure that we bring this perspective to the forefront of the table as well. So thank you, Craig, for sharing that. If you don't mind dropping the state that you're in, if there's anybody else that's in your state that may have resources, or no other people in your state that have resources, that may be helpful for you, feel free to do that. Or if anybody wants to reach out individually, feel free to do that with kindness and respect in your hearts. And then we're gonna transition to Candice. So in your coverage, you've talked about the public health disparities that actually lead people into the system in the first place. And we've been kind of talking about that a little bit, But can you share some of the stories that you researched and that you covered that have shown how these issues are so compounded for particularly for minorities, women, Black folks, LGBTQ people, and especially people that hold all of those identities at once?
Yeah. I know this is more aimed at like the front end of things and what leads people into carceral systems, but I was really moved by what Justin shared. And it really helped to reframe in real time, like how I think about my own reporting. So I just want to also highlight some stories that get out at this piece of civic engagement as public safety and community connectedness as something that helps to support communities as a whole. A couple years ago, I wrote a story focused on Connecticut being the first state in the country to make prison and jail phone calls free. And this was led by everyday people in Hartford, Connecticut in particular, who partnered with a nonprofit organization called Worth Rises that has done a lot of important work in the prison communication space. And so they were able to get that law changed. And you could feel, I came in after the law was changed, about a year or so after it had been implemented. You could feel visibly as we were walking with this one particular woman who had an incarcerated son, Diane Lewis, her walking down the street with her, and people just immediately responding to her, overwhelmed at how this law affected their community, mothers being able to stay in touch with their children, like all of these different layers that data indicates help reduce recidivism. And then I also quickly want to share another story that we did, election 2024. I interviewed a woman, Angela Pluta, who was formerly incarcerated, and she got to vote for the first time because of a law that restored her right to vote in Nebraska, like literally right before election day. And she, like, part of what we have in the headline is that it changed her life because she just had no interest in voting because she was kind of like, I've been shut out of this system. Like, I'm not interested, right? But through the course of getting hired at a civic engagement center and learning about the voting process, and then them encouraging her to register to vote and vote, she was like, oh yeah, I'm like committed to this work to help other people realize their right to vote and understand that. So this is a detour from what I was really going to preparing to talk about, but I just think that that's important to note. More on the front end of things, we've talked a lot about kind of the mental health. Overwhelmingly, the majority of women in jails, for example, have some kind of mental health condition. We know overwhelmingly that sexual violence and other forms of violent trauma are affecting women who come into this. A story that I had known a lot about that heading into my work at the 19th, but a story that I covered 2 years ago that really kind of shocked me was more so related to the criminalization of HIV in particular. And so about 29 states to this day have laws that criminalize certain behaviors related to people living with HIV. And so, for example, a person living with HIV might have sexual contact with someone who then could accuse them, right, of exposing them to the virus without their consent or knowledge, which is a criminal offense in many cases in many states. And so these unsurprisingly, are related to kind of the stigma of the 80s and 90s. But we know with modern treatments today, people living with HIV have a similar life expectancy to those who don't have HIV, but we still have these laws. So in my particular story, I focused on the state of Tennessee, which has a felony criminal exposure to HIV offense, which if someone's convicted of that, can lead to a sentence of up to 15 years in prison. And at that time, this has changed, but at that time, you also had to register as a sex offender for life in Tennessee. And so that's just an example of one thing that we can see, I'm sure, like how that can disproportionately affect people who are already overrepresented in the criminal legal system. Black people, you know, Latina people, LGBTQ plus people, sex workers, etc., and also can discourage people from getting like the testing and treatment that they need. And so I don't want to, I feel like I could go on. I don't want to monopolize all of this with other examples, but I think it's also important to note that, as we've already said, the incarceration levels for women have been rising for years. They're the fastest growing incarcerated population in the country, and also that comes with a price tag, right? So I recently wrote a little bit about a report from the Council on Criminal Justice that found that the overall cost to incarcerate a growing number of women is expected to rise from between 23 billion to about 30 billion by 2035. And so we've been talking a lot about the front end of things, right? So imagine the money's being spent, right, as the incarceration levels are rising. So I think it raises the question of like, what does it mean if we used money to address some of these systemic issues to lower incarceration levels?
Absolutely. And Amanda and Justin, our justice team, they're having a lunch webinar tomorrow that may be of interest to some folks. Amanda, I'll let you chat about that a little bit later. Diane, I'm going to come to you, but this is also a question that anyone on the panel can jump into after Danielle. So, as I mentioned, we're heading into the midterms soon. A lot of states and cities have already started their primaries. What are some questions that voters should be asking to assess, or what are some things they should be looking for to assess who of the candidates may have a genuine public health and public safety platform, who is really serious about safety, and what should folks be looking for?
Yeah, this is complex, and I'm going to try to distill it down because I think this is about how we rethink about what safety is, and it's a shared responsibility. So, one of the things that we need to ask candidates is, what does public health mean to you, and policing? And why aren't you investing in systems of care such as mental health, treatment on demand, harm reduction services, MOUD? So, you think about medications for opioid use disorders. Amanda is very familiar, and the folks in the drug policy world. Why are we still, in this day and age, awaiting a federal bill on this issue over things like this? I think that we also need to ask them, what is your view of safety? I think right now is most politicians are very binary on their view of what public safety means. It's either one or the other, instead of looking at the continuum of care that needs to be done. And, how do we build it? It requires investment, trust, shared responsibility. And to Amanda's point, I think this is really critically important. Cuts to social safety net systems are actually going to increase crime. They're not going to decrease it. There is empirical research going back decades on the issue of Medicaid and SNAP benefits actually enhance community health and safety. So when people have access to housing, care, and support, communities become more stable, individuals are less likely to offend or reoffend, and safety matters. And then most importantly is, how do you develop trust? What is the policymaker is, if communities and institutions aren't trusted, people are less likely to seek help, report harm, and work together to prevent it. So I would ask them, if we continue to treat addiction and homelessness as problems for the justice system to solve, are we going to get the same results? And if they don't have a good answer for that, then this is the real difficulty, is that I think that as subject matter experts, not just us, but people with lived experience, is there are times, because I spend a lot of time in Congress and up in the Hill and in with local and state staffers, we actually know more than they do. And so they need that narrative and that storytelling. And my view is critically important. Let me say this, but it is made much more powerful when I can bring in an advocate like Amanda or Justin, or a story that's been told by Candice as an example of why the system needs to be changed with solutions. So I think being able to provide them with solutions as well, not just saying you're the problem, it's we have these solutions and we know these things work. So it's create grace for staffers and policymakers. Not all of them are evil. Some of them are just ignorant. And that's not a good or a bad word. It just doesn't mean that they know. And so I think that is democracy building. This is how we make our vote count. Is like we try to educate people, we ask them about policy, and if they can't deliver the policy that we know works, then we need to vote people in and out. And that's the power that we have. So, Worth Rises is a great organization. We worked with them and, on a variety of different things. We've worked with dream.org, is find those unlikely bedfellows. And this isn't just a right-left issue. I can tell you that there's a lot of conservatives that actually believe in policy reform and right-ending the system. So look for unlikely allies. And I know that's kind of a mouthful, but, I just want to end it, is that if we continue to treat addiction and homelessness and socioeconomic issues in this false binary, we're not going to move forward. And the more success stories like Amanda and Justin and others that I know are in the chat, the better off we are. So really appreciate it. Please be at any time for follow-up.
Thank you. And I want to put an exclamation point on the testimonials piece, because you mentioned, Congress people, a lot of times they just don't know. And so people are in their face telling them, this is what I'm experiencing in real life. And I live here in DC, but they also talk about that with DC City Council. A lot of advocates are always asking people like, hey, we need people at these city council meetings so they can see your face, so they can hear your voice and really have that personal touch to what's happening. Otherwise, the advocates who they see all the time are telling stories of other people, and that doesn't necessarily always land. And then it gets complicated because, sometimes meetings are during the day, folks have to work, so it's more difficult. But just want to put an exclamation point on that. For people that do have, lived experience across a lot of different issues, when and where you can, if you can lend your voice and your face in person during these meetings on the Hill at your state legislature, please do strongly consider that. And I do also want to flag Eric Beller's comment in the chat, who said he, is trying to create some help for other folks. Once was a horribly addicted person who went from working with a big college and then ended up through substance use and homelessness. And so, Eric, I don't want you to feel shame. This is a safe space. None of us on this call are without sin or, without things that maybe we would have done differently. But I appreciate you for being here. I saw that you also mentioned you and your wife do a lot of justice work in Kentucky. I'm not sure if you're already connected with Amanda, but if not, please do. We are deeply embedded in the justice community there, and we definitely want to find ways where we can collaborate where appropriate. And my last question for the group, unless anyone wanted to speak to questions that they should ask their candidates, you can ask that when you answer this next question. But what is one thing that all of you want everyone to know or do in the next 30 days? What is, the next action that you think that people should be taking? And you can go in any order. Candice, I saw you come off camera, so I'm going to let you go first.
Okay, got it. Mine's gonna be very on brand for me as a reporter. I would love for everyone to pick an issue, whatever issue, if it's justice, public health, both, and maybe find a nonprofit newsroom that you think speaks to that issue and covers it well, and consider reading them. If you have funds, the funds to do so, maybe consider donating. Even $5 is so helpful. I work, if you're not familiar with the 19th News, we were started, I'm like 6 years ago at this point, nonprofit newsroom that covers the intersection of gender and politics. There are so many other newsrooms around the country doing important work. Nonprofit newsrooms tend to be more diverse. Women tend to lead them more frequently, women and queer people, etc. And they tend to be more mission driven. So I'm gonna pop a link into the chat with a handy tool where you can find different nonprofit newsrooms that may speak to your interests.
Thank you, Candice. And Candice also dropped a couple of the stories that she referenced too. So if you guys have time, save those links and read that after tonight. Who wants to go next? Go ahead and jump in, Justin.
For the next 30 days, practice connection. Gabor Mate says that safety is not the absence of threat, it's the presence of connection. So I encourage everyone to practice making new connections.
I love that. Community is an underrated tactic to progress. So let's make sure that we are always in whatever capacity trying to find ways to not only build but to nurture too. It's a long-lasting back and forth relationship. So thank you, Justin, for noting that. Amanda, do you want to jump in?
Yeah, sure. And I'm going to piggyback off of what Justin said. Get civically engaged. And that may not be voting at this point. I remember I was involved for years, and in Kentucky, I couldn't vote because of my conviction. But we were able to fight, and I know Deb's on here, for years until the governor changed that and I could vote. So there's no reason, like, no matter what, you can get engaged now. Join the Empathy Network. Come and fight with us. Me and Justin love new friends, and Ray, the whole dream team. So yeah, just get involved, get civically engaged, and if you can vote, vote.
Yes.
Please.
Mitzi said challenge accepted, Justin. So Mitzi, we're gonna hold you to that next time we see you on here. And I also forgot to mention, this is a series conversation. The first one was about voting rights. This one today is about public health and public safety. The next one will actually be about housing rights and housing affordability. And there's some themes around that have popped up in the chat. And so we'll make sure that we follow up with you guys to make sure that you have the RSVP information for that as well. And last but not least, our brilliant Diane, how do you want to contribute to this last question?
I think that my big theme for the next 30 days is compassion. And I think compassion goes all ways, and respecting people's trauma. And one of the goals of LEAP is for people to recognize that police are people too. And I'm not defending bad law enforcement practices or correctional practices. Let me be very clear. We will hold people accountable, but we have to have grace for people with trauma. And my role is to uplift the people we have harmed. That's why LEAP exists. We all have our epiphanies that the system was harmful, but also recognizing that grace and humanization of each other gets us to better systems of care where everybody feels safe, including police officers. Shared safety is real important.
Absolutely.
And then vote, vote, vote.
Vote, vote, vote. Compassion, community. These are verbs, by the way. They require an act of doing something. Just want to emphasize that. And also news coverage. Make sure you're supporting and following nonprofit media and your local media too. I'll add that. Amanda, I have two things I want to ask you. We have one Q&A question. Amanda, you spoke about being in school and receiving no help. If you had the opportunity to speak to a teacher or counselor, what would you tell them now, or what would you need? What did you need then? And we also have somebody that wants to know about the opioid settlement webinar tomorrow. So if you could also speak to that, and if somebody from the Dream Team can drop that link. Oh, Amanda already did. Thank you.
Yeah, so tomorrow at noon Eastern time, we're having a webinar about Kentucky specific opioid settlement funds. For folks that don't know, in the United States, $58 billion is going out and should come to communities. It's lawsuits around opioids, like from Purdue and all these folks that prescribe so much. Every state has a bunch of money, millions, some states billions. Tomorrow we're going to talk about Kentucky, but in a few months we'll have one nationally. You can learn about opioid funds, how to fight for that money to go to your communities. And then back when I was in school, I wish somebody would have just told me that I was okay, that I wasn't the only kid, that I mattered, that my mom mattered. It was so confusing because the world told me she was so bad, but she wasn't. That was my mom. And I had so much shame and guilt and embarrassment and anger and all of that bottled up. And then when I started using at an early age, that took that away. And then that's how that cycle goes. But if back then, if somebody would have just told me I wasn't alone, like Justin said, I think that would have made a world of difference.
Yeah. Thank you, Amanda. Any other questions? Yeah, John is going to be on that webinar, Eric. Any other questions or comments? Favorite quotes and tidbits from the evening? Well, if not, thank you again to our esteemed panelists. Please give them some heart, some love, some hand claps, and some blessings. I really appreciate your time. And also, I appreciate all of the work that you all are doing. You are here not just because you are subject matter experts, but you're in the field, you're doing the work. And I personally admire the work of all four of you. So thank you so much. Thank you, Dream Team, for helping out. And everybody, have a great evening.
You guys are the best. Thank you.
Thank you. Have a good one.
Thanks, everyone.